these have got, oh, if you haven't noticed, these have gotten increasingly informal, and I think that's a good thing because we want to have a lot of conversation. This is, I can't even remember now, is this the fifth or the sixth event that we've had? Fifth, thank you. And it's the second one where we've gotten real granular. So one of the things that we've been hearing for a long time is business leaders want to hear, what can we do? What are some specific steps and action steps we can take to start to address the issues we're talking about? And our lead guest speaker, Tyra Johnson-Hutz, from LISC, Western New York, did an absolutely wonderful job 2 weeks ago, last month,
yeah,
on procurement and contracting. And her presentation was so well received. We've talked her into doing at least two more. So
what? Two more? Wait a minute.
Today, and then one more. Today, and then one more. At least I said. So today, Tyra's going to walk us through some workforce development. So, how do you recruit and retain a workforce that's really reflective of the community in a way that can make a difference? Because we keep coming back to this: how do we make a difference in the lives of people who really need some help, and people who've been living in communities that have needed this level of help for generations? So, Tyra has some extra special guests. I will let her introduce them. Before we get started, the one last order of business, I'd like to thank the planning committee, Rita Hubbard Robinson, Pastor George Nicholas, Tom Schenk from formerly from Blue Cross Blue Shield, Tim Murphy from the University of Buffalo Community Health Equity Research Institute, Julie Barrett O'Neill from LISC, and of course, Tara Maving and Caitlin Cratheras from Population Health Collaborative. So welcome everyone, and I am going to mute myself and turn it over to Tyra. So thanks.
Thank you so much. So we do have two special guests, and we'll be talking to them a little bit later on, and I'll introduce them later, but I'll just start again with a little bit about myself. Again, my name is Tyra. I'm Deputy Director of LISC Western New York, and in my role, I have a very specific focus on what is called inclusive economic development, and I focus on Black and Brown people in Western New York. I'm working to shrink the opportunity gap. Some of you may not have heard of LISC, but it has been around for 20 years, Local Initiative Support Corporation, and we're doing a lot of great things. So at some future time, I hope to tell you more about what we're doing. So as was stated earlier, this is the second time that I presented for this group, been a facilitator / presenter. And I know what some of you are thinking, because some of you know me. Okay, why is Tyra speaking again? I don't think she's ever worked in healthcare before. Well, you would be right. I have not worked in healthcare, but I am what you call a broker. Okay, so a broker is one of three different types of networking styles. From this famous Yale professor, you might have heard of her, Marissa King. She says there's, you could basically break yourself into three categories. And a broker like me, I easily adapt to different groups. But more importantly, as a broker, I do pretty well at translating across groups. Okay, so that's one of the reasons why they invited me back. So I want to start this presentation by telling you a story about my experience in building a workforce. I had left a well-known construction firm. It's been more than a decade ago. And when I was leaving, somebody that was very unexpected asked me what I was doing. And I told him about my grand vision for my retail shop, and I was also going to be doing consulting work. And, he looked at me, and quite frankly, he didn't care. He didn't care what I was doing. The reason why he was asking me is because what he really wanted to know is, would I put together a training program for the building trades? So before that ask, I had spent years talking to young people about careers in construction and architecture and engineering. I had created internships for the company I was working for, but not only that, I pushed interns into other companies. So the suppliers, the subcontractors, I would say, hey, you're taking this young person, and you're going to teach them what you're doing. I focused on Black and Brown people. And so this tradesperson asked me to create a program that would get more people of color and women into the building trades. Now, I'm going to tell you about that process a little bit later on, but I'll give you a spoiler right now. It was not a huge program, but it was valuable. It was valuable for those lessons learned that I will share with you today, but it was also valuable for the people that were in it, the specific people. For example, the other day I saw a young man, I'll call him Alan. He stopped me in Wegmans a couple of weeks back. So I thought I was being incognito because I had my mask on and I was looking at the avocados in the produce section. And he stopped me and he said, Tyra, he recognized me right away. And he said, you know what? Do you remember me? I've been an electrician for a few years now, and I'm going to try to get my cousin to do the same. Now, Alan, Black young man, he came from a modest background. He now has a very sought after skill. And because he has the know-how and an N, he could help his cousin navigate that system. And I'm not saying it's easy to go through that system, but he was an on-ramp, just like I acted as an on-ramp to him. So let me just pause and say I started this presentation about talking about being a broker, which sometimes there's a downside to that because brokers are sometimes met with a little bit of suspicion. But for many of you in the audience today, you're probably what is called conveners. Conveners are people that are great at building trusted networks and they have tight circles. And I would say that many of your organizations are convener like. I like to think that LIST, the organization I work for, is more like a broker, but many of your organizations are convener like. And that means, by that, I mean that you don't want to put your reputation on the line. You want to bring people into the fold that you know and trust because you're avoiding uncertainty. And of course, most businesses want to avoid risk and uncertainty. So let me get to my slides. I know you're probably thinking, where are our slides? Yes, I do have some. All right. So look at this slide. Actually, LinkedIn suggests that the number is a little bit higher, that 85% of job placements actually come from networking and not job postings. So think about this. Where did you get your last job? Was it from a posting where you just kind of cold call and put your resume in, or did you know somebody? I really think that networking is critical to the conversation that we're having here today because so many of us have this kind of convener mentality. I think it's part of the reason why this stat is so high. Because there are, well, it's high, but there's some risk to having that stat so high because people are keeping their networks tight. They're not letting other people in. There's a risk with groupthink because people come from similar backgrounds. There's also a risk with limiting innovation. And innovation comes when you put together different perspectives and ideals together of people that normally wouldn't come together. And then one of the other big risks is that you have a risk of untapped talent if you're going with, the circle that you know. So again, why did I bring this up? Because I think it has everything to do with inclusion and equitable workforce. Most people will not put their neck out there for someone they don't know. They're really reluctant to bring somebody else into the fold and then ask for change for people. People that don't have the same background as them, people that don't look like them, people that are not from the same social group. So most people will not provide guidance to somebody that is outside of their circle. So what does that tell you about building an inclusive and equitable workforce? It's hard, right? Think about it. If you don't have social capital, it's really hard to break through. Think about how you got your last job. Was there an on-ramp? Did somebody purposely give you a way in and help you up that ladder? So there's one more risk I actually forgot to mention earlier, and this is a huge risk. If you don't take on a mindset in which you're trying to get more people in the fold, I think the biggest risk is that we're leaving people behind. Okay? So in this healthcare system that we have in this ecosystem, you implement mechanisms to improve health. But today, why we're here is because we want to talk about transformation and about not leaving people behind and kind of breaking out of that circle. All right, so let's go to my next slide. So poverty is a major obstacle to health. And for those of you that have been on these presentations earlier, the ones previous to this, you've talked about this. It's a self-perpetuating problem. It affects families for generations. Poverty affects things like life expectancy. I read an article the other day that said that after the age of 50, you can expect rich people to live 14 years longer than poor people. I mean, that's amazing to me. It affects things like your ability to learn. It affects things like your risk for developing disease. But poverty also affects things like education and your lifestyle. And poverty affects your work. Okay, so here's my spiel. I have this graph for you. We know the best way to get out of poverty is a good job. And closing opportunity gaps, or that gap, is the disparity in achieving like a family sustaining job. And I'm going to say for Blacks in particular, we can help reduce unemployment. We can help reduce underemployment. We can reduce poverty. Now, I've been doing a lot of reading because, yes, as I already stated, I'm not in the healthcare industry, but I do like to make sure I'm informed. And I know that we're trying to combat health disparities by expanding access to healthcare. We are telling people to support healthy habits, and that's all great. But the piece we are focusing on as a collaborative is promoting strategies to reduce poverty. So last month, we spoke about procurement, and I believe that recording is available if you're interested. But this time, it's time to talk about workforce. And just like caring for a patient with limited means requires sensitivity and understanding, so does designing a plan to lift up a segment of our population that has been left behind. So, big picture here, the healthcare ecosystem can be a way to alleviate poverty in Western New York with careful consideration, sensitivity, and understanding those issues that affect our neighbors. So, here is my outline today. After talking about the who and the what is the healthcare industry in Western New York, we will discuss the how. I promise I'll get to the how. And by how, I mean an approach for more equitable workforce development. And so I will lay out a strategy for you to construct a plan in your own organization. Fair enough?
Can I jump in a little bit?
Sure.
You've raised the issue of healthcare, the healthcare industry several times. Of course, we know that there are people here from the University at Buffalo. There are people here from the baking industry. That we have all of these wonderful partners from various sectors. And so we don't want you to think that what we're talking about is healthcare in a very traditional sense. What we're talking about is the health of a community, a health of our city, and how we can pull levers and pull mechanisms and pull collective planning together in such a way that we can improve the health. Because of course, if we have more healthy people, I hate to say this out loud to those who are in healthcare, we don't need healthcare quite as much. So, but if we have healthier people, we can have a certain lifestyle in our community, and we can certainly enjoy the ability for generations to be healthier. So if you lose your loved one 14 years prematurely, that means they're missing their grandchildren. They're missing opportunities to teach a legacy work like gardening and baking and cooking and things like that. And so, and also all of the traditions and values that families have and should have, those are all lost and missing. And so we are really talking about lifting health and the benefit of healthcare as one industry, but there are a number of different industries that are represented on this call. So thank you so much, Tyra.
And I really appreciate you saying that, Rita. I'm going to I'm going to pick on the healthcare industry because I have some very specific examples today, but really the information I provide can be used for any organization or any industry. But it will be abundantly clear why I'm picking on healthcare in a little while. Okay, so this slide is for Pastor George because I can hear him in my head wanting to reemphasize this point. And again, I'm going to pick on the healthcare industry right now, that healthcare spends money on the back end of a problem. And by that, I mean, a lot of times money is spent on people that are already sick. And so what I'm talking about here is reallocating the dollars to the front end of the problem so that we can prevent health disparities from happening. And, I know this conversation might be a little bit difficult. It may make people a little bit uneasy, but our goal here today is to help our community and our neighbors. So I realize, in the title of this presentation, and you also hear me say this several times today, I use the term inclusive, but then I put in big bold letters, Black people. And I understand, that may seem at odds, but I want you to understand this. One, I'm not just advocating for Black people, because, when you make changes to advance Black people, you're really advocating for everyone. And so I always like to compare this to the principles of universal design. When you make something accessible to a particular group, it helps out everybody. And then the other thing is that, yes, I have Black people in bold letters because we have a big problem. We have 40% of Black people living in poverty in this area. So that's why I highlight it. And I'm going to pause there in case I said something about Pastor George, in case he wants to jump in there. I know he may not be able to, but I'm just going to give him a second just in case he wants to say anything on that.
No, I mean, you're right on point with your work, and it's really about, as I put in the chat, building vibrant, prosperous, strong communities where Black people are living, and in order for that to happen, Black folks must have access to well-paying jobs, and we got to make sure that whatever the barriers are for Black folks to getting these well-paying jobs, that we address those directly and intentionally.
Thank you. Was I channeling you when I put that slide up? No?
Yeah. I mean, we're right there. We're right there.
Okay, all right. All right. Okay, so yes, I'm gonna pick on healthcare for just a little bit longer. It becomes a little bit shocking to me because I believe that Buffalo is particularly well positioned to embrace health equity and combat poverty, given the prevalence of healthcare institutions that are already sitting on the east side of Buffalo, that are already helping to shape the city's economic growth. So we are asking our community, you watching this presentation, to push diversity, inclusion, and equity at all levels of your organization and in your talent pipeline, and then in your supply chains, like we talked about last time. But I also want to give it like one more level. We are asking you to push it in your C-suites and on your corporate boards as well, right? So let me give you a few more headlines here. If you already didn't know, healthcare is the top dog locally in terms of economic drivers. So that's another reason why I'm going to pick on them. But again, the things that I'm talking about universally it could go for other industries. So we have all these facilities. There's a lot of jobs that are dedicated to the healthcare system. And we have a lot of facilities on the east side, and they're physically located there. So the $1 million question is, what else can we be doing? What else can we be doing except for just being physically located? There's so much more. And I can have, the stats and things I'm using. I do have a reference slide, so if somebody wants to know where I got these things, if you get a copy of this at the very end, there are some references that you can check out for yourself. I'm all about the statistics and kind of making sure that I'm holding true to them. So actually, here's another one that's full of information. And I don't pretend to be a statistician or a specialist on census data. And quite frankly, it's really hard for me to drill down on microdata necessary to tell you like how many Black people on the East Side or employed by a particular industry. But what I did find is this report called Healthcare Workforce in New York Trends and the Supply and Demand for Health Workers. And this was published in 2018. And Rita and John, this is where I wanted to open this up for discussion a little bit and look at this data. And these are the most in-demand jobs in Western New York. And I just asked the audience, what, if anything, does this tell you? I understand this is a limited amount of information. And Caitlin, if possible, that's the first link I gave you, so you could put it in the chat. So if you're really interested, you could look at the rest of the data. It has, I think Western New York is probably the very last segment that you'll see in there. But I'm just going to let you ruminate on this a bit. And I cannot see chat or if people's hands are up or anything like that. So Rita, John, you tell me if anybody wants to comment on this.
Yeah, Caitlin just put the link up in the chat, so I'll jump in if I see something, but hopefully somebody will just speak up.
I can keep on going and talking if you want me to. But I just found this fascinating when I looked at the data, and I'm actually kind of looking over here because I have two screens. So these again are the kind of the biggest drivers in terms of the jobs that are for healthcare in particular that are needed. It shows the number of jobs, it shows the hourly wages and also the projected openings. And what I see here is yes, we want to cut poverty in half and we want to eliminate unemployment, but we also have to consider wealth building. All right. There is a value to increasing well-paying and rewarding careers in terms of equity. And if you see some of the jobs here, they don't pay very much. So it's one thing to say, we have all these jobs and we're going to fill them, but they're paying minimum wage, or they're paying at a poverty. Like if you take them, you'll still be in poverty.
Hey, have you seen our canals contract? This is an active bid right now because maybe they would have interest in that.
Right. I was going to say, Tara, we won't talk about healthcare aides because it's obvious that we should be paying more money.
Mm-hmm.
But let's go with nurses. So in defense of the healthcare system, this goes prior to. So you have to get people interested at the educational level to be a nurse before you even get to where they're going to be employed. We all need nurses. You can find a job tomorrow if you're an RN and you're interested and willing to work in healthcare in any one of those key areas: hospital, health plans, nursing homes. Okay, so, and it pays significantly well, even compared to the nation. So this one really isn't about equity of wealth. It's about people becoming interested in the field of nursing. And nursing used to be a big deal. And I don't know where we lost a generation who's no longer interested in caring for people in general, but specifically as nurses. So it goes before you get to the industry's hiring. How do you get people in the pool invested and interested in that from an educational standpoint? So and it goes the same with physicians, right? Physicians, nobody could argue physicians don't make good money, but we don't have a lot of physicians of color. The question is, what happens in the educational process, right, to get people interested? Is it because it's too much schooling? Is it too expensive to get through the program? What is it before you get to healthcare? I just want to
I'd like to tag on to what Broderick was saying. And yes, we do know that we need pipeline programs and that from 5th grade on, because if you don't choose in middle school a science-based high school, you're not going to ever be on track for a healthcare job, whether it's nursing or in the as a medical doctor. But also I think, to Heather's point in the chat, you do have people who are interested in healthcare by virtue of them either being an aide or an assistant. And so having internally in an organization a career path, a career ladder or lattice, as she says in her chat, that would be a way to build within the organization with known workers in the space that are interested in healthcare, to build them and to provide them with opportunity to create the skills so that they can make the $35 an hour job. Also, I would say, important to look at, and we are looking at healthcare, but when you look at other industries and you have the similar kinds of positions, there's that high level CEO, C-suite, middle management that tends to be what they call the umbrella, the white umbrella over all the other all the other positions where Blacks are allowed to enter in. And there's never a process, a internal mechanism so that you can work your way up the ladder. So I just wanted to add that to the conversation.
Can people hear me? I don't know.
Yes, Valerie. Yep. But now they can't. You're muted somehow.
Okay.
There you go.
Okay, great. Hi, everyone. Some of you know me. I know lots of you on this call, and I always try to sit quietly, but it's so hard for me. I am originally from Buffalo, spent many years living in other cities. I currently now live in Albany, working for New York State. But I spent a number of years working in healthcare in Buffalo. I was the director of employment, recruitment, and diversity for Kaleida Health for maybe 3 years, 2-3 years. And worked at Rich Products and Graphic Controls and some other organizations in Western New York. And everything that everyone is saying, I couldn't agree with more. The challenge is that all of these things have to come together concurrently. One of these approaches will not be sufficient. And when I was in that role, working to lead diversity and recruitment, that role had been 2 people. And when I joined the organization, they combined it. So the resources and the capacity to devote to trying to determine how do we bring people of color into the Kaleida Health system of 10,000 employees was diluted automatically, because that's a problem-solving issue. And for those who are on this call who are in recruitment, you also recognize that recruitment's problem-solving, especially finding nurses. And I had one person who worked for me to support me in the area of diversity. And that person, wonderful, wonderful person. But the assumption that organizations continue to have that if you are a person of color, well, then you know what this work entails and you know what you should be doing to bring people of color into the organization is an automatic birthright, is very limiting, because that's not the case. This is a particular discipline trying to understand how do you break down the barriers? Because at the end of the day, we're talking about massive system organizational change. And that organizational change at the core of it for most of us requires us to look at what's in it for me. And so the CEO, all of the vice presidents, the board, all of those folks who are in significant decision-making roles, who have an opportunity to create a vision that can be materialized and operationalized in the organization. There has to be a decision that there is something in it for them, be it financial or otherwise, that they are willing to invest in the incredibly difficult and deep amount of work that the organization has to engage in over a long period of time. Because
Go ahead. I was just
go ahead.
To chime in, Ms. Broderick. I'm nervous because I just recommended a gentleman who's coming from the state, doctorate in African American Studies, undergrad in counseling, works with teens and youth that need all kinds of services to get them back on the track, et cetera, for that very job you spoke about. I spoke to some people over there to say, listen, I don't send you anybody if y'all gonna play games. They know me. And they've assured me that this time around, it wasn't gonna be a Valerie situation. Because mind you, they only have one person. Now they just offered him the job, which I knew he was, no question, they would have been making a mistake to not pick him. I wasn't worried about him wowing them. What I'm worried about is, we wowed you, I'm here, okay? George Floyd's been dead a year. Now what? And I don't want to see this man leave a state job, come over there for them to drop, you know, because you're right, you're Black, so you know everything it is to know about Black people. So good luck with that. And we can't behave this way. So they've assured me that they're going to put all the C-suite people, all of that behind this, and some money so they can build on this to be more than a 2-person department and really do what needs to be done. Because again, that's the biggest healthcare employer in Western New York. This is a big job. It's no joke. And they can't afford to play with this man's bread and butter, okay? And I told them that, and I'll be on top of this one, because if they could make a very big change, if they do the right thing, because there's no question they got the right people at the table, but they got to be done to make it go further. So I had to speak on that because you know what I'm talking about, coming from that. And the question is, how is that changed years later after you left? Right?
I don't know, because I moved on, and I will tell you one of the reasons that I moved on was it was so incredibly difficult, albeit impossible, to make the kinds of changes that would have been meaningful. But one of the things that I recognized was, when I look at the slide that Tyra has put up about the number of jobs in 2017, and those numbers will increase over time. The jobs that we had in Kaleida that were paying good money for someone with a high school diploma and a certificate, be they a phlebotomist or a pharmacy tech, we could not bring Black people into those jobs. And it just did not make any sense to me. I had 500 jobs open on any given day, and I could not bring Black people into the organization. And it became evident that our young folks are ill prepared to go through an interview process. We worked with community organizations, and we got young people of color into the pipeline, and then they would call my recruiters and curse them out. Or they would sit through the interview process and not be equipped to answer the questions effectively. So then I thought, well, okay, let's start some programs with community-based organizations that help teach young people how to go through the interview process, because how would they know? Right. Grown people don't know how to go through the interview process. So let's teach them, let's give them the tools that they need to have. And then an opportunity came up to work for the Buffalo schools, because what I was trying to do was create a partnership with the Buffalo schools, given that Kaleida's hospitals are situated where those students live. Can we create a program with the Buffalo schools that will allow these students to get the licensure, the certificates that they need to walk right out of high school and into Kaleida, pick a hospital, into one of these jobs? And they will be equipped through the school system. And so Tyra, what you said about being a broker, where you are translating for different entities, is so important, because after a year of going back and forth with the Buffalo schools to try to create this program, I realized they were talking New York State, State Ed, Civil Service East, and I was talking Healthcare East, and we were not using common language, and we got nowhere, because I didn't understand what the problems were, and they didn't understand what I was looking for, and it went nowhere. So that
there's something in the chat. I want to jump in real quick, because Joe Fritz, who's a local healthcare leader, the CEO of Dent, raised a very, very similar issue. He is very well intentioned and would love to hire more folks, but he's finding the same sorts of the interviewing skills, challenges with transportation, childcare, all these other kind of life factors get in the way of his efforts, and it just makes, you said this is difficult, and you couldn't be more right. So I'm just wondering if there's any kind of insights, or maybe Tyra, you're planning on getting to some of those later, but it's interesting. The other thing too I want to throw out there real quickly, and I'm not even sure there's a solution to this, but Joe raised the point that the salaries are really tied to reimbursement rates, and As a country and as a culture, unfortunately, we don't really value these people. These people taking care of other people, the personal care aides and those folks, we like to, we kind of pretend they're invisible, and we say we value them, but we don't really value them in a way that's meaningful with money. So just a couple of big structural issues that are really problematic.
I'd also like to add, I got a private chat as well, that the elephant in the room is the Buffalo Public Schools. So I'm glad that Valerie brought that up, and that, our children are not prepared sufficiently in the Buffalo Public Schools. And then you have programs like UB STEP, where, this is where I even met Heather when she was just a little girl. And she's got this nice big fancy job at Blue Cross at Highmark. And so, and also the CDO at Kaleida is a graduate of STEP. And so, that's science, technology, enrichment program. I mean, this is where you would have the opportunity to get the extras, the soft skills of extras that you get at that other program, that side program, that after school program. Now, this is a program that was across the state of New York. I'm not sure if all of them are gone, but I know the one at UB is gone. I just found out about that last week. I did not know it. It was dissolved during the pandemic. So this is a big deal. And I think that we need safe spaces to have these conversations. And I'm really glad that this is one of those spaces in which we can actually have the frank conversations and begin to grapple with and figure out how we can transform opportunities and also create opportunities within organizations to promote as well. Thanks.
All right. So some of you I know may have joined a little bit later and you didn't see Valerie DeBerry's name on the first slide. So she is one of our guest speakers, and I'm going to give her ample time to kind of answer some questions later on. And we have another one, Deborah Porter. I'm here just to provide a framework and at some points, I guess, to spark the discussion. And so I have some more that I'd like to give to you. And so I'm going to continue on. And this one I think is just, it's for context. The title of this presentation was Fueling an Inclusive Economy, Models and Practices of Equitable Workforce Development. I know it's a long title. And I wanted to put this up because a lot of times people will use these terms interchangeably: diversity, inclusion, and equity. And I just want to put some context to it. So sometimes people say that diversity is like getting an invitation to the party. And then inclusion is like being asked to dance, but equity is more like saying what type of music can make you dance best. All right. So, okay, maybe that's not the best analogy, but it will help you to remember it. And I know that being asked to do something or about something doesn't necessarily necessitate inclusion and equity. Really, they're more about value and implementation. And so let me just backtrack a little bit. A diverse workforce includes individuals from different genders, racial groups, sexual orientation, socioeconomic. There's other characteristics I know I'm missing. Diverse teams, usually create more unique ideals because you have people from different experiences and they view problems differently. But I really want to emphasize that a company that can have diversity and not have inclusion. Okay, so without inclusion, employees end up in silos. They end up stuck. They may feel like they're underutilized, that they can't advance, that they're underestimated. They might just feel invisible. So without inclusion, there won't be advancement of marginalized groups. I can tell you from personal experience and working in the construction industry, which is probably one of the most siloed experiences you can have. If I really thought there was room for advancement at that time, and if I even thought, I was either 50 or even 30% included in the conversation, I probably wouldn't have left, but I wasn't included. So just carrying on to equity. Equity asks us to acknowledge that everyone is different. They have different experiences. The way that they got their education is different. People from marginalized groups, specifically Black people, Also women. There's barriers to overcome in accessing resources and opportunities. And we've kind of touched upon that a little bit, and we'll talk more about it. But in an inclusive organization, if you're inspired by equity, you identify these barriers and these inequities, and you try to help elevate people, meeting them where they are, and you try to get them to an equal playing field. So I'm going to move on to kind of my framework to what I call an equitable workforce approach. And really what I'm talking about is kind of like looking at things in-house in your organization. And I hope that our speakers will speak more to getting people to the table. But I have this 4-step process I'm going to lay out, and then we'll get to our speakers. First, it's the analyze, prioritize, design, and act. So I'm just for a moment going to go back to my story about the trades, because when I did that program, I started with a series of questions. And I really had to go in with a beginner's mindset, because you know, me acting like I know everything with a group of grizzled, kind of older white guys was just not going to fly. So I had to go in and just start asking questions. But I would suggest that everybody here take on that beginner's mindset, having an attitude of openness and lack of preconceptions. You got to almost forget about what you know and dig for the details when you're doing an analysis. So in the case of construction, I already had some data. I had been doing a census on the trades locally for years. I knew how many minorities and how many women they had. I know which trade they were in, but I did not stop there with the questions. I asked, what are you looking for? Specifically, what skill does that person have to have? How do you get those skills? What are you recruiting for? Why isn't it working? Have you tried these other options? And from those questions, I had a team that worked with me, and we came up with a program we thought it could work. But I didn't pretend to have all the answers. And the program, yes, it was small, but it had some successes. And so we were able to do it again and again, and we made improvements along the way. And then at that point, when we were doing it again and again, we even started to get calls from the Department of Labor asking about if we wanted special qualifications and how they could strengthen the program. But ultimately, we ran out of resources. And I think that's a common refrain. You run out of resources, or maybe you just don't have the people to take on this work. But nevertheless, we learned a lot from doing that. And we know that we were giving people a leg up to that job track, a job track that would include paid training and benefits, which I think is really important. Okay, so let's go to, step 1. And we know that people of all racial and ethnic profiles, they're distributed throughout our talent pipeline. But we need to understand where those different racial groups, and Black people in particular, are concentrated. I think this is really crucial to the process. So a good first step, and this is just, basic, would be looking at your EEO information, your equal employment opportunity data, and then figuring out the demographics for different jobs. Like, do you have a lot of people that are in this particular job? Where are they? But, this is just a very basic first step, and you could do better. So a better thing that you could do is really knowing that all workers are not starting from the same position. There are barriers, education may be one of them that you are considering. Training levels is another, it could be an issue. And these barriers to employment, can't just be solved by posting that, you have a diversity and inclusion policy. You really kind of have to dig into the details. And so I know employers use data to analyze for diversity, but you also have to look for inclusion, and you should be examining access to high opportunity jobs by race and gender and ethnicity. So in this region, it's very apparent that we find that Asian and Pacific Islanders and white workers are more likely to be employed by high opportunity occupations. And Black workers are least likely to be in these occupations, and they're more likely to be employed in low opportunity jobs. I just want to give you another example from my experience. When I was developing the trades program, I told you about that young man. I called him Alan. And so I had to tell them that for a lot of the trades, you can't do an application online. Okay, so you're going to have to go to a union hall on a particular day of the month, and it's not every day. There's like one day a week you need to go, and you need to, it's not in the city, most likely, so you need to get a drive, you need to either drive out there or get somebody that can drive you out there, and you need to have your resume with you and your references with you, because you can't take that application with you, right? So you have to fill out that application right there, and it needs to be neat, and you need to have all the information you require with you. And then also, for some of those trades that you are interested in going into, Alan, there will be a test. So, and for at least 3 of those trades, you need to know advanced math, and you need to know maybe trigonometry. And that when you get called for an interview, if you get to that point, you need to, consider the way you dress. And here's a tip: don't wear a suit, and don't wear torn jeans. You should wear khakis and a polo, Alan. Okay. And if somebody asks you if you go to fish or hunt, you have to say, I have a license. Now, that may sound a little bit extreme to somebody that's not in the construction industry, but I think you get my point. It's almost certain that if I started asking you a line of questioning about jobs in your industry and the application process, and I will say specifically for those that have unions in them, you would hear things, I would hear things that I would think was odd. And so really figuring out how to navigate those systems, or having somebody that can advocate and say, this is what the system looks like, here's all the things you need to know to actually kind of get past this point, I think is really important. Okay, so that's better. What else can we do? I did my good, my better, here's the best. Looking at quality of jobs, looking at high quality jobs. And I think this is particularly important because you can do training, but training does not guarantee a better life. So looking back at those numbers I showed you, there are some people in very fast growing occupations in Western New York, and they just don't make that much. So we need to not necessarily assume that we just, look at the numbers and do labor-based, need in terms of certificates and training, but we need to really know that we can figure out how to get jobs that can adequately support a family and lead to career growth, right? So low quality job training, low paying jobs are not evenly distributed in this area. People of color at all education levels overwhelmingly make up the workforce in lower paying jobs. So how do we break through? And I just want to give you this place called PCV Insights. They defined what they thought was a quality job. So I just want to dive into this a little bit. Making above the industry median wage, having a decent standard of living. The next one is basic benefits. So that would include some paid leave, some health insurance, retirement savings. The third bullet on there is career building opportunities. So either including some in-house or external workforce education and opportunities for promotion. And then, this wealth building opportunities. And I don't know if Julie's out there, but I put this, I want to make sure she hears this one because, profit sharing or having some sort of cooperative model is something that she likes to talk about a lot. And then finally, we have a fair and engaging workplace. Maybe offering some flexible hours or at least predictable schedules. And I bring that up because some people, they get jobs and maybe they only have a part-time work and they have to have 2 days a week they're at a night shift and another day they're in the day shift. And that just doesn't work if you have a family, right? It wreaks havoc on a family. So ensuring that you get, a fair schedule, that you get equal treatment, that you are getting employee consultation, and that you're getting performance reviews so you can see where you're going. So I think that our workforce development thinking really has to shift to focus no longer on what the biggest number of jobs are, and not just upskilling, but how to create a system that looks at not just employer demands, but those equity considerations as well. How do we get people there? Okay, so The next thing I have is step 2 in my 4-part plan. You've done some analysis, and I'm so glad that Valerie told me earlier before you all came on that she was watching some Star Trek the other day. So I'm going to give you my analogy. So I think step 1 is kind of like Dr. Spock. It's data informed decision making. You look at the numbers, you look at the rationale, and so you're ready to move on based on those decisions. So step 2 is more like James Curt. And so you need to take the helm and you need to make sense of all the circumstances, and you look at the landscape and you draw upon your collective experiences. And I say collective because I know you're not going to do this in a silo. You need to get people to help you and look at this. And maybe you talk to Ahura, you talk to communications, because why wouldn't you have to ask a Black woman. I'm just going to add that in there. You need to talk to other people about how you should maneuver. And you also need to get your allies. So, what are those allies? And I would suggest that you, think about who are your allies and how you're talking to them. And yes, I'm using a Star Trek analogy, but I guarantee that you're going to remember this better if I just said it without the analogy. So I'm going to continue on with my analogy just for a second. So I would suggest that you get some alliances, also known as intermediaries. And we have somebody that works for an intermediary as one of our speakers. So I won't really dwell on this, but this could be somebody that you might have been hostile for your organization, but they are working with people. They know how to find people that need jobs. They know how to get to people that have passion. Again, it could have been somebody that didn't quite have alignment with you in the past. Maybe it's like the Klingons, but when you get them on, you realize that it works really well. And so I think that's really important. So we're going to talk a little bit more about that. And so I'm going to go to step 3, and step 3 is your design. So I swear this is the last Star Trek reference I'll make. You have to go talk to Scotty. Okay, so Scotty is in engineering, and whatever measures you take, you need to drive a process of continuous feedback. Okay, you want to focus on collecting and sharing data, and dare I say, maybe sharing it with other companies. That can potentially transform the health or our ecosystem, our business ecosystem as a whole. So I'm going to use a medical analogy now. People in the medical community, you're used to working with patients, and you might have a plan to fix it once and now, and that makes sense because, for example, if I have somebody operating on me, I want them to understand the reasoning and why they're doing the surgery, and knowing that they're going to do it and they're going to do it once and I'm good. But when it comes to systems change, you might want to consider something that we borrow from the tech industry is more like agile design, because you can't always get it right on the first try. So with agile design, you take small steps, you incorporate shared decision making. Agile is an iterative process. It supports kind of small incremental outcomes. You get quick results, but ultimately it helps you to adapt to unknowns quicker. So it's really about challenging, or I should say acknowledging that things change in the real world and your assumptions may not be right. So you have to be able to pivot and get through it. So maybe instead of like creating a manifesto for DEI after a year of thinking and doing analysis and things like that, you should instead prioritize some items and go out and evaluate and make that process better. Okay. So my fourth, I hear a beep, so I'm not sure if somebody's trying to talk, but my fourth step that I want to talk about is, it's self-explanatory, but I think it's the most important. You need to act with the data-informed decisions. By tracking and using multiple measures, you can ensure workers who face systematic obstacles can get good jobs. So you're tracking like where those bottlenecks are, where those pivot points are. How can you move those? But if you don't track and you don't give this feedback, you won't be able to move the ball. So at this point, I'm just going to put that slide up and we're going to transition. And I just would like to say, this is a little food for thought. Skills matter, but for those living in concentrated poverty and who have other constraints, the skills are not enough. So somebody who's trying to advance, they need to feel like they have a voice. They need somebody that can help guide them along that career path. They need advocates. They need considerations of circumstances. That all goes a long way. So I have the esteemed honor of introducing our next guest. And so we have two other people, one of who you've already had a chance to hear from. And so we don't need to necessarily do this in the order that I have it on the slide, but I think I saw Deborah earlier. Deborah, are you there? Oh, I see you now. Okay. So why don't we have Deborah Porter come up, and she's from Buffalo Center for Arts and Technology, and that's one of those intermediary organizations I was talking about. And Deborah, I know you gave me a few slides, and I'm going to ask Caitlin, if you're out there, to share them for me. And Deborah, why don't you, could you just introduce yourself and tell us a little bit more about your background?
I am Deborah Porter. I'm the Director and School Administrator for the Adult Workforce Program at the Buffalo Center for Arts and Technology. I have been in this community for eons. I've been on the ground floor, I've been a recruiter, I've been in different nonprofit organizations, including the Erie County Department of Mental Health, Read to Succeed Buffalo. I have 22 years of banking at HSBC Bank. I can tell you that when I was working at the bank, I never imagined myself working in nonprofit. I have been over here on this side of the world, and I have learned an enormous amount about my community since I've been in nonprofit. Rita, it's good to see you again. You're one of those people in my beginning stages of walking in this realm. But at the Buffalo Center for Arts and Technology, we've only been in existence since 2014. And so we've only been around for about 8 years. And I actually started out there as their marketing recruiter, receptionist. It's a small business, it was a startup. And so you had to fill in all these different roles, and thank God for the previous transferable skills. I was able to fit into a new startup and bring the skills that I had earned along with me. The Buffalo Center for Arts and Technology has two pieces to it. One part of it is the adult workforce, and the other part of it is the Youth Arts Center. And we are following Bill Strickland's model, who started this process 40 years ago, and there are 8 centers. We were center number 8. The goal was to encourage the youth in the arts and offer the arts in a way so that the students would have access to it and to stay engaged in school through to graduation, because that was one of the challenges that he had. The other side of it was, how do you engage the adults that are supporting these children that are in school through education to help them be able to lift up themselves and their community in order for them to reach the sustainable wage situation. So I'm on the adult workforce side. And on this side, we can go to the next slide. You will see that when we started out, bing, bing, next. When we started out, we did not have a whole lot of space. At the time that they built this space over in the Art Space building on Main Street, which is across the street from Delta Sonic, there wasn't a whole lot of space there. And so what we've done is we've utilized the space that we have, and now we have exceeded this space where we need to find more space because we are growing. We started out with 2 programs. We started out with medical coding and pharmacy technician. And we have great results from that side. And now we've expanded into medical billing and insurance. We've expanded into phlebotomy, and we've actually brought in landscape this year. And next year, we're going to bring in a whole IT hub. But what you see here is the limited space in this design now, right? Says that we have exceeded this space in our expansion. And that's where we're at now. We're at an expansion growth stage now. Next. Next slide. When you look at the Buffalo Center for Arts and Technology, you have to take a couple things into account. Number one, you have to take into account the population in which we serve. My population is primarily 85% African American, and then and in the city of Buffalo. When people come to our program, we see ourselves as planting the seed. And planting the seed includes a whole lot of fertilization. It includes putting the seeds out there, getting the people, and I'm going to go through what that whole process looks like. But what we have to do is we have to nurture our community. We have to understand that when they come into education, they are low income, they are poverty, they have mental health, they have experienced trauma, they have tried to overcome, they have had jobs, they have lost jobs, they have had all kinds of challenges when they decide to go back into school to get training, to get a second chance at life. Many of our adults, our average age is 32 in the pharmacy tech and 38 in the medical coding program. So we're not talking about the 18 to 24-year-old group. We're talking about people that have families, that need help, that want help, and that is out there looking to get the help. They need that kind of mentoring and coaching that they need to rebuild their self-esteem, to help them understand what their mental health is and that it is not a handicap. And how do you make this work for you? Our goal is to get them through to graduation so they can get the job. But there's a whole lot of work that has to go into that before we do that. So our medical coding program started out at a 9-month program. Our pharmacy tech program started out as a 9-month program. During that time period, there's a process that we had to go through. Next slide, please. This shows you the process that we had to go through. From the time that the student enrolls into the program, then there's orientation. At orientation, we are talking about what your attire needs to be coming to school. Bill Strickland's philosophy was you change the environment, you change the behavior. So we have them in this beautiful environment. Now we're expecting them to change their behaviors, but they need to be coached and guided on what that behavior needs to look like in the new environment in which they're in. We're talking about your dress code, the earrings, the torn jeans, what you should wear, what you can't wear, why you shouldn't, why you're going into healthcare, what the expectations are in healthcare. We're giving them that information right there at orientation. We have this process called the affirmation story. The affirmation story is the first piece of helping the adult make the transition mentally from where they are to where they're trying to go. If we don't help them make that transition, going through another educational training program is just another educational training program. We have to be able to inspire and motivate them. The affirmation story is a process that I use to help them through the mental health challenges that they have, so that some of that information comes out in a very safe environment with a person that understands what they're talking about. So that affirmation story, you will be amazed at the amount of strength that the people in our community have based on the challenges that they have been through, but they never realized their level of confidence. And neither did they realize the level of strength they had. All they have been in is in this position and in this role of called survival. And so they never knew what strengths they actually brought to the table to get from one incident to another incident, and then still be able to say, I still want something else out of life that's important. I see other people with it. This is what I want. How can we get them to shift their mindset so they can get what they want? And that is through the mentoring and the coaching. There's a whole story that they have to rewrite their entire story. And they rewrite that story based on what they want, not what they've had. They're looking at their present, and then they're planning for their future, not focusing on their past. When they get to the education side of it, that's where they're doing the academics. That's where they're doing, and it's more like college level academics. It's not like a training program you go through and you don't have to do any work. You have homework, you have notes you have to take. There are things you have to do in an academic setting. So you have to have instructors that understand the population that is coming to these classes, that can provide that mentoring and that additional support because they have different learning styles. How do you help them in the classroom with different learning styles and their adults? Which means some of them are coming here that had IEPs when they were in high school. They've been out of school for 15, 20 years. Their learning disabilities are their learning disabilities. But the way I see it is that if you get to my program, we are here to help you overcome what those challenges were. For example, I have a young lady that's in the program now, in a medical billing insurance program, that has a learning disability and had it when she was in school. It appears that she has a problem reading the textbook, so she needs to have the books read to her. So what we do, we went and found the book and purchased the software that she needed in order for her to be successful in the program, because see, that's what you do when you're focused on the whole person and not just the numbers of getting people in. While our program is small and while we're only taking 10 to 15 people per class, you need that 10 to 15 people per class so that you can give them the nurturing that they need in order for them to feel the confidence and be successful in the program in which they're in and to complete the program. Then we have the professional development. Now, when you're talking about the interviewing and the dressing and all of that, that's what we do in our professional development. In the professional development, we're showing them how to search for a job. We're showing them how to research a company. We're showing them how to do interviews. We're doing the mock interview. I am the person, they do not want Ms. Porter to do a mock interview with them, okay? They want somebody else to do it, but they don't want me to do it because I took a model. When I left HSBC Bank after 22 years, they sent me to an executive training program for me to get myself repositioned into the workforce. I took that model and I brought it to this program so that the content, how do you do your transferable skills? What does your transferable skills look like on your resume? How do you create the resume? How you create a resume that's specifically for the job in which you're applying for, so that resume is tailored? How do you run that job description and your resume through a job application tracking system to see how well do you qualify for the job in which you're applying for? This is what we're learning in the professional development. This is how we're helping them to build up the confidence. When they have the opportunity to do and research the companies, then they build more confidence. So before they get out of the program, the goal here is to find a job that you're interested in, and let's tailor your resume for this particular job with the skills that you need in order for you to get the job. So we're teaching them how to read that job description and pull out the skills that they have and the transferable skills. Now let's go and look at your background and see how does that all fit in. Then we also have national certification.
I'm gonna just pause for a second because I know we have limited time, and people really want to probably know, like, you have a small group of people, which I think is wonderful, because you need to give them that dedicated attention it takes to get to that next level. But and you also said that you're looking to expand. So can you talk about, like, how does a company, we do have some healthcare companies here and we have other industries, how do they connect with an organization like yours? Like, what is that model for them to be working with BCAT or an organization like yours, and how does that work best?
Okay, the way that will work best is that internship. We need employers that are willing to provide internships for our students and hire them. Part of their program is an internship. The medical code and pharm tech is an internship. But what we find is that at the internship, our students are going to the internships, they're being successful at the internship, but the internships, and let me not forget, these internships are unpaid. So they're already struggling and they're unpaid. They've made a commitment and they're doing the internship, which is off-site. They're not being paid for it. They're not getting hired. Now, what I have noticed over time is that because my population is primarily African-American, and I have a few whites and non-whites in the program, they're getting jobs, but the African-Americans is on those internships, they don't get jobs, they don't get the offers. Okay,
that's interesting.
And I don't understand why, because they are prepared. They have been exceptionally well through the program. They've lasted for 9 months. They have done the resume. They've done everything that is, including getting a national certification for the job. I actually had an employer that 2 of my students went and applied for a job, and they both have national certifications. And one question was asked of them by the interviewer: are you an introvert or are you an extrovert? She answered the question that she was an extrovert and therefore she didn't get the job. When she reported that to me, I called the company up. I called the human resource up. I wanted to have a conversation to understand why was that particular question important. What I was told is that when COVID hit, the people that they lost were the extroverts. I said, so because she answered that she was an extrovert, you excluded her from hiring her. I said, let me tell you something. This is a person that during COVID did online 6 hours a day for 4 straight months, was there every day on time, doing the work and doing coding. When you say, can she work independently? She has already demonstrated that she can work independently. So my question is, why did she get excluded because she's an extrovert? Let me tell you why she answered the question that way. First, because in her family hierarchy, she is the extrovert. She is the family hierarchy. She is the person that everybody go to. But see, what you're asking is whether or not she's capable of working independently. I can tell you from proof she's capable of working independently. My suggestion for you would be, I think you need to call her back in and see if there's another question you need to ask her as to the reason why she's disqualified.
So Deborah, I think you're really illustrating the point that people need advocates, but they also need unbiased hiring.
Yes.
Organization. So we only have a few more minutes,
sorry,
Deborah, because I want to make sure Valerie gets a chance to speak too. So
yes,
I just want to make sure that, you know, I think the program that you're running over there is phenomenal. And I know that you're expanding. Yes. And so could you just reemphasize, like, what are those categories of work that you're doing? And is there a possibility of, you know, expanding to different categories of work?
Okay. We're doing allied health now, and now we're moving into an IT hub. And in the IT hub, we're going to offer IT help desk, support with CompTIA with A+ certification. We're doing Salesforce administration, and we're doing Microsoft 365 fundamentals. Those are very high-level IT jobs. They are entry-level jobs in some companies. We're going to be looking for employers that would be interested in hiring. Part of our, along with the IT, along with allied health, comes with the certification. So we're paying for the students to be enrolled in the program. We're paying for the tuition. We're paying for the certification. And if they get the certification, I want employers to consider hiring them.
Oh,
expansion,
excellent.
We're out of space. We need more space. So we're trying to figure out where's the space that we can get, that we have 6 programs and we have 3 classrooms right now. Now we're talking about bringing in 3 more classes. We don't have no space for it.
Okay. Well, hopefully there's somebody here in this group, because I know we have a lot of influential people here that could hear that call to action that you're saying, that you need to keep on doing your good work, but you need the space to do it. So we're gonna, that's my PSA for you.
And just do one thing. I don't even have to talk. Show the last slide, the next slide. I don't even have to talk. Valerie, it's all yours. This is just the data.
I just wanted to underscore one question that you had of Deborah before Valerie speaks, and that is that it sounds to me that you put the program together as part of a pipeline for industry, and that I heard that there is more need for pipeline for other industry. I think I'm trying to remember the name of the gentleman who put in the chat his desire to hire, and Fritz, Joseph Fritz. Like, if he were able to contact you directly, is there an opportunity to develop another program that would help create a pipeline into his industry, for example?
And thank you for bringing that up, because I already wrote Joseph Fritz's name and number and name down and know what company he's with. And I have reached out to Dent before, and now I will have a contact person to reach out to Dent again. But I'd love to have that conversation with you, Joe. So I'm looking forward to it. I will be in touch.
Thank you so much.
Thank
Deborah.
you.
Thank you, Deborah. Now I want you to kind of, you know, stay on call, but I want to bring Valerie up to the plate. Mr. Berry, did I lose
She's
Valerie?
muted.
Have to unmute.
Okay.
Okay.
Okay, now we can hear you.
Yeah.
And you don't have slides, so we could stop sharing the slides. Thank you.
Right. I don't have slides.
It seems like so many people that are here today already know you, Valerie, but can you just talk a little bit more about your background and your career path, and to give us just some context about your level of expertise?
It's a long journey. I am from Buffalo. I went to school in New York City. My very first job out of school was working for Procter & Gamble. I was a production supervisor at the age of 22, supervising a department of 50 white men on second shift who had no interest whatsoever in having me work there. They were all of my peers were engineers, and I was the first female, the youngest female, the only Black supervisor that the IB department had ever had. And that was how I started my career, not having any idea of the maelstrom that I was walking into. But it was probably to this day the hardest job I ever had. And it is a job that I would do again, because unbeknownst to me, there was so much that I had to learn to survive in that environment. But I realized it was not a job that I wanted. I moved on. I worked for Cigna for a number of years, and then I ended up coming back to Buffalo, where I've worked in manufacturing, as I said, for graphic controls. I was at First Niagara, and the Kaleida experience was very interesting for me, and it was very telling about the Western New York community. I also spent a few years running human resources for the Community Action Organization, CAF. So I've been in public sector, private sector. Now I work for New York State, tax and finance, manufacturing, finance, CTG. And what I can tell you that's consistent in all of those experiences is there is an academic understanding of the benefit of recognizing that we are a diverse state and we have a population that represents a whole host of demographic facets. And smart people who work in these organizations recognize that, and they recognize the fact that that can impact the bottom line or whatever the outcomes are of those organizations. And because of that, there is always an academic acceptance and recognition that this is the right work to do. So diversity is a fact. It exists in the state, it exists across the country. Inclusion is a choice. And that choice is really about how people are experiencing the other individuals with whom they have to interact on any given day. And the biases, I'm sure everybody here has had some exposure and training around implicit bias and what all that means. But those biases that impact the decision-making of the people who will decide to hire an intern or not, they're real. And so if individuals are not prepared to recognize that they need to be mindful of their biases when they're talking to potential applicants, candidates, and what they can do to get past those biases, whatever it may be, because someone is Black or tall or heavy or whatever it may be, those things become very much a factor, not intentionally necessarily, but in the decision-making of how someone will make a choice. I know one of the early on reasons why I was able to get the job at Procter & Gamble, because most people in this country have a particular bias towards the school that I went to. And oh my gosh, I went to Columbia. She went to Columbia, so she must be X, Y, and Z. That's a bias. That had nothing to do with me, but it was their bias, and it worked in my favor. So I've had a tremendous career as a result of that. But we're not good in recognizing our own biases and the impact that that has on decision making. And at the end of the day, all of these wonderful organizations that we're parts of, that other people are situated in, the people who are in these supervisory roles are often told that they will hire an intern, or they are told that they need to hire more diverse talent. And that's the end of the story. These individuals are presented to them either in person or via resume or application. And we just somehow expect that magically the people who are now told that they must hire more diverse talent will automatically do that. Not only will they automatically do that and make a good decision, not just hiring a person because they are Black or brown, but that they will then embrace that person when they bring them into the organization and do everything that they would do to help that person succeed, as they would and I don't know how I sound, but I know often internships are often reserved for the children of the people in those organizations. So now those kids are getting overlooked to bring in people of color, and we're expecting those parents to treat those people of color as well as they would treat their children and give them those same breaks, that same information, and help them navigate the system. And that's not what happens. And so Black and brown children, adults come into the system, and if they're lucky, they will connect with someone who will see something in them that they can relate to. So the numbers game is important. It is critical to understand where the opportunities are, where the gaps are in how our organizations are constructed demographically. But at the end of the day, we're talking about how do people engage with other people and what is in it for the individual to have that person that they just hired be successful.
Mm-hmm.
That is a lot of complex and deep work because we assign people managerial supervisory roles. We give them some degree of training, I guess, I hope. Interview skills, remember you talked about how HSBC sent you away, because that's not necessarily a training that organizations offer their people. And it's not something that everybody knows how to do when they wake up or they're anointed manager or supervisor. But that is now part of what their responsibilities are. And they do what they saw their boss do, or they do the best they can. And they hire people for reasons that have really very little to do with the actual work.
Mm-hmm.
So it is complex, and young people of color, Black and brown kids, are already starting out behind the 8 ball because there is so little that they have in common to create that thread of connection with the decision maker who is in front of them for hiring. So when it comes to that translating, when it comes to that creating a connector, that is so important to get them in the door. And then once they're in the door, helping them understand the pitfalls of how you succeed in that organization. If they ask you to go to lunch with them and you don't want to, do you go anyway?
Mm-hmm.
Probably. But who tells them that?
Yeah, you almost have to have somebody coaching from the inside, but you have to have that coach has to recognize their own internal bias and kind of try to break out of that themselves.
Absolutely.
Valerie, you used a term that, so Pastor Nicholas, you're doing a good job of getting in everyone's head, but it reminded me of something that Pastor Nicholas had said several times. You said if someone of color starts to work in an organization, and then you said if they are lucky, they will meet with somebody who can kind of guide their career, help them. And what keeps coming back to me is Pastor Nicholas says we need to be intentional. So those lucky, those fortunate breaks that happen, managers, leaders, directors, people who are already privileged enough to be in those positions can't just rely on their new hire, their people of color being lucky. They need to find those people, and they need to aggressively say, I'm going to help you with your career. And when I ask you to lunch, or when someone else asks you to lunch, you say yes. So taking the luck element out of it and making it much more intentional, and having all of us kind of keep that, in front of mind. So when those opportunities arise, I think will be absolutely crucial for all the reasons that Tyra talked about at the very beginning, about all this stuff works because of these informal social networks, and to exclude a whole group of people from those things. Again, I'd like to think that that's not always intentional, but whether it's intentional or not, it's having the same consequences. So we need to be intentional about breaking down those social barriers, those informal network barriers, and really reaching out and making sure that, again, we're not just relying on luck.
And Valerie is Browder. Speak a little bit to the concern that I'm sure this is in a smaller organizations, particularly in larger organizations. It's not uncommon that it's really the middle managers where that philosophy gets lost. So you have the C-suite people finally coming to grips that not only is it the right thing to do, but it's business advantageous for us to have diversity inclusion, right?
Yep.
All right, so they send the message, this is where we're going. It's gonna be a new day. But they're not the people who are hiring the majority of the people. So if the people at the middle managers, lower middle, don't have that philosophy, really don't care, they don't really feel it, touch it, right? Aren't about it. This is where the breakdown, because coming in, you're never going to get to the people who think it's the greatest thing since sliced bread to hire more people of color and diversity. You're going to get to the person who really just trying to fill the position and don't really have that same mentality. So, and they're hard to find. Those people are buried in the, in the workforce. You don't really know that they're not on board. So how does that work? And that's a big problem.
And Valerie, before you answer, we only have about a minute left, and then we have to wrap up and figure out the time of our next meeting. So no pressure, but in 60 seconds, tell us what you think.
Whoa, okay. Well, back to accountability, back to numbers. You can choose to go the path of accountability, and Tyra, I think, mentioned performance management, which is arguably a valuable tool. But if you hold people accountable and you then have a conversation about what is it that they have done in the area of diversity, equity, and inclusion, and you associate something that's meaningful to those people as a part of that performance management system, be it increases or bonus or whatever it may be, that's an attention getter. And that kind of gets you compliance. And the more people are exposed to other people from other dimensions of diversity, the likelihood is that there will be an increased level of commitment that evolves from compliance when there can be a relationship based on real human interaction and over time. And the challenge is, Broderick, this doesn't happen over time. This is a long process. If you get a onesie twosie hit in a given year, you're doing well.
Okay, that's helpful.
All right, so folks, we have 1 minute, and we do have to pick the date for our next conversation. So the poll apparently only stays up for 1 minute. So Caitlin, go ahead, and everyone, please vote before you leave. The next meeting will be about direct investment in on the East Side community. So
John,
we're a little bit rushed, but I want to thank everyone. Yeah.
Can you hit poll, please? You're the host.
Oh, I am. All right. Where do I do that?
Just at the bottom of the screen.
Gotcha. Thank you. All right. Launch polling. There we go. Is that up?
Yes, we can see it.
Terrific. All right. So before we do go, and again, we could have this conversation for days, and we will, and we should. But I do want to thank, again, Tyra, for doing an absolutely phenomenal job. Valerie and Deborah, for those of us who know you, it's great seeing you again, and glad you're still incredibly active and as articulate and bright as ever. So we will keep you in the loop because you're just too good, and you've got your heart set here too. So
I'm also trying to convince Valerie to come back. So
there you go.
She would make a fabulous consultant for anybody that is looking. Department of Finance. They didn't hear me say that, but I'm just putting it out there.
So we're getting pretty good responses. If you haven't voted, please do before you leave. But we will leave on that note. So thank you again. This has gotten terrific. Keep in touch with us if you heard anything, particularly if you're in a position to do something helpful and you heard something that really sparked an interest. We will keep after Joe Fritz, who had to leave early, but he is on the Population Health Collaborative Board, so we will keep after him. And the rest of you, please step up. These are not designed to be academic exercises. These are really designed to give people action steps. So we want to help everyone and anyone who's willing and able to make the world a better place by doing this great work. So I think we're good. Please.